If you didn't know already, we of course celebrate Valentine's during the month of February, but it's also Heart Health Month. And as much as we want to consider that for this month, we should think about our heart health every day. I'm here at Coastal Cardiology with Dr. Greg Silverman to talk about some of the basics, just the basic things you want to consider every day for your heart health and how to elongate your life. So first, tell us a little bit about yourself.
Well, my name is Greg Silverman. I grew up in Corpus Christi, went to school certainly in Texas, and then came back down to Corpus Christi. Have been here for 27 years practicing cardiology with Coastal Cardiology. Have seen lots of people and think we do a pretty nice job with cardiology and cardiac disease here in town.
I think so too. With that much experience, you're doing something right. It's a beautiful office. Everybody is very welcoming. The atmosphere is wonderful, and I think we look for that, especially if you're spending time in a medical building. But let's get to the heart talk. What are some of the basics that we need to understand when it comes to heart health?
Well, the most important thing certainly is know your numbers. That is, know what your numbers are. Know your cholesterol numbers. Know your blood pressure. And certainly know, if you're a diabetic, know what your sugar numbers are. But weight, we can also understand that as well. So know what your weight is. And understand where that play comes into. That is, if you have high blood pressure, let's get your blood pressure down. There's nothing that works better than getting your blood pressure down. Know your cholesterol numbers. Let's get your cholesterol down, because you can really prevent disease that way. Not just sort of treat it after it's already been there. You can actually prevent the disease long term. I say you can't outrun a bad diet.
That's so true.
And unfortunately, one of the best things about South Texas is the food. And the food is caloric dense. And so you got to be very careful with that. If you can't outrun a bad diet, you got to be aware of what it is you put in your mouth and what your diet is, and be aware of how many calories you take in. And that's really important. In addition to that, exercise makes a huge difference, especially once you get a little bit older. The ability to move and the ability to get up out of a chair every day. I keep telling my patients, you don't sit getting to 90, you have to run to 90 or walk to 90, and that's real important as well.
I've heard great things about strength training too, right? To help you,
of course, that's
yoga,
right.
all
Squats
those
are it's been shown that the number of squats you can do predicts your lifespan. So
the number of years
important.
You can add to your life.
There
How about that?
That's right. Get up and get moving.
Very good. Okay, so for someone like myself who has a genetic predisposition for heart disease, what are some things that I should be considering, or how can I be proactive?
Well, certainly, if you know your numbers, go to your physician and say, look, I have a family member that has had heart disease before the age of 55. That's the number that we're looking for. And if you have, say, okay, have we got blood tests? Have you checked my blood pressure? What do I need to do to prevent this from affecting me as early as this? And your physician can either send you to us or do it themselves, and they're very good at it. That's what we're all good at now, is preventing disease down the line, and it's very important to do that.
Very, very good. Okay, well, I feel like I've learned some takeaways. I've got something to keep with me, and I'm going to be better about tracking my numbers. And if you're someone who's forgetful like myself, keep it in your notes or take a photo or something. It's very easy to search up those documents so that whenever your other physicians ask for that information, you have it easily accessible. So if we're interested in your services, visiting you or your great staff, where do we get in touch?
Call us at 887-2900. We take new patients all the time, and we will see you as soon as we can.
Very good. You won't be waiting months on end to see your cardiologist. They'll see you right here, and they're located right off of Texan Trail. Thank you so much.
Thank you.